Okay, class. This is kind of a special one. I do this for the paramedics, but I'm going to do a little separate one for EMTs. And the reason I'm going to do that is because there's only kind of one way that you guys give epinephrine, but it's important to understand what epinephrine does and how we deal with it with our patients here. And when I literally say with great power comes great responsibility on this one, that's very much a true statement. So for the EMT guys, again, you're going to see it in different forms. You're going to see epinephrine on the trucks. You're going to see epinephrine in a vial, in a small ampule. But the way that we're going to use it is usually with an auto injector. So down here is an adult auto injector, what I'll commonly refer to as the EpiPen. And that's how we're going to use it. Again, it's pronounced epinephrine and epinephrine hydrochloride. Yeah, when your epinephrine allergy makes your heart race, well, the reason that your heart races because of epinephrine is because that's the way epinephrine works. It was designed to do that. And the reason is that it's a naturally occurring catecholamine. We make epinephrine. We call it in our body adrenaline, okay? So what we use it for is relief of respiratory distress due to bronchospasm, and then provide rapid relief for hypersensitivity reactions. So again, an anaphylactic reaction is what we use it for. And again, on the more ALS level, we use it to restore the cardiac rhythm, okay? It makes the heart more irritable. And when we're trying to bring somebody out of a heart rhythm in which they don't have as much irritability, we try to irritate the heart so that we can actually shock it back into a perfusing rhythm. Now again, it relieves bronchoasthma paroxysms, which means it reverses the spasms which they have when they're having difficulty breathing. The smooth muscle tightens down inside the bronchiole. The epinephrine actually causes that to release. Okay, the other real big one is so the other big thing that we use it for again is to speed the heart rate up. But then again, that's done at an ALS level. So yeah, when you're working that third double this week, yeah, can I have your epinephrine? Because definitely, again, you're going to need some help. You're going to need some stimulation there, and that's what epinephrine does, guys. Is it stimulates the body. Again, imagine that you go to Halloween Horror Night, somebody jumps out and they scare you, and you all of a sudden, immediately you're scared to death. Your heart starts to race. You start taking bigger, deeper breaths. That's what it was designed to do, okay? So when they talk about an adrenergic reaction, it's again, it means that it's a natural, that mimics the natural release of epinephrine. It does those things. It speeds the heart rate up. Because it speeds the heart rate up, it uses more myocardial oxygen. It uses more oxygen that goes to the heart. So again, in a heart attack, that's a bad thing. In an allergic reaction, that's not necessarily a bad thing. Catecholamine, again, it's an amine that's derived from the trypsin. It's a hormone and a neurotransmitter. What allows us to, again, breathe deeper, for the heart to go faster, for all the peripheral nerves to shut back down, takes the blood away from the skin and puts it more in towards the central things that you need: heart, lungs, muscles, brain. Okay, that's what the drug is naturally made to do. Okay, when we talk about alpha and beta effects, alpha refers to your blood vessels, what it does there. Usually it tightens down the blood vessels. Beta depends on the heart or the lungs. Beta 1 is the heart, speeds it up. Beta 2, lungs, dilates the bronchioles, okay? But it has a very profound beta effect, okay? Which is why actually we like it for allergic reactions, okay? We really do like it for allergic reactions because, again, it causes those bronchospasms to stop. It reduces the swelling part of it. And it antagonizes the effects of histamine. What actually causes the allergic reaction, guys, is a histamine release, okay? It's basically an immune system response in our body, which causes swelling to the area. We like that, except, of course, when it goes overboard. When it goes overboard, that's when you have that allergic reaction. All right. So, again, by the way, all of those topics I just discussed go way, way deeper. but for the purposes of this is what you need to know. Less than 2 minutes is usually when we give it IVP or IO. If we give it IM or sub-Q, it's about 3 to 10 minutes. And probably the IM version is about 3 minutes, okay? So, again, it usually lasts for about 5 to 10 minutes. Now, the good news is that usually enough to turn around an allergic reaction, okay? Most of the time it is. Very rarely do you have to redose on an epinephrine pen. And again, we use it for the EMT side of it, we use it for anaphylactic reactions, okay? Now, for us, again, we use it by physician order only. Our job is to assist the person in giving it to themselves, okay? Now, again, we show you how to do that, how to pop the cap, how to put it down by the leg, and then we help the patient give it to them. But we also need to have a physician's order. Usually this is an online med control order, okay? We do not administer it from the brown box or we draw up the 1 to 1,000 epi. That is an EMS, it's a paramedic level skill. You just don't do it, all right? So what is it, if I told you all those things that it does, what are some other things that you can expect? A headache, it draws blood, it changes the blood that goes to the brain. It can cause somebody to be shaky, nervous. Again, that's a standard side effect. It eats up myocardial oxygen. Because of that, you can have chest pain with it. You can actually start to throw dysrhythmias. They can go tachycardic. They can go hypertensive, okay? A little bit of hypotension can occur in low doses, but usually the EpiPen that we do, it's a higher dose. You're not going to have that problem. You can send them up to a very fast heart rate, okay? And they can have palpitations because of that. It may cause actually some pulmonary edema in some cases, okay? This drug is actually nausea, vomiting. That's usually due to the change in the blood pressure. The gastrointestinal system is not used that much with this. It diverts blood away from the GI system. Therefore, you're going to want to get rid of the food that's in there. And again, it can cause tissue necrosis if you give it IV. And you can have the other thing that this does is it does elevate blood glucose levels. So again, make sure you check your sugar about 15-20 minutes later. Make sure that they haven't gone way too high. Reasons that you would not give epinephrine, and they are very few actually. If it's a cardiac-related tachycardia, okay, in other words, 150 or higher, and they're not having the difficulty breathing part, it's got to watch and do that with caution. Again, if they have high blood pressure, and we're talking like the 250 over 150 range, guys, not the 160 over 90. Again, if they're in anaphylaxis, there really is no contraindication. If they're in cardiac arrest, there's really no contraindication to doing that, okay? So see that bottom statement right there. For what we do, no contraindications. All right. If they're on a drug like propranolol, metoprolol, any of the OLOLs, the beta blockers, guys, this inhibits the effect. Remember when I said that the beta-2 effect actually causes bronchial dilation? Well, the problem is that they take a drug that blocks those things from happening, okay? So you're probably going to need, that would be a time probably that it's not going to be as effective. Usually in anaphylaxis, though, I will tell you that it very rarely does the beta blockers come into play. Again, protect the valve from light. Again, that's why it's in the covering that it is. Some of your asthmatic kids, you might get some transient syncope that happens, and that's usually due to the blood pressure change. And then again, epinephrine increases the cardiac workload, okay? So, again, it's going to cause the heart to beat stronger and faster. Because it beats stronger and faster, you're going to get those effects of it. They use up more of the myocardial oxygen. If they're having a heart attack, gang, again, very rarely do you get an anaphylactic reaction going on with a heart attack. It's, I guess, statistically possible. Nothing really major on these guys here, okay? But if you do have a patient on, you're going to be given an EpiPen too. Hopefully you've got them on 100% oxygen already. That's kind of the takeaway from this slide. Now, again, high doses of Epi, they do have a preservative that can cause bronchoconstriction. The EpiPen, that does not play, okay? It really just does not. And we talked about the hyperglycemia just a little bit earlier. Now, again, these are the preparations that they come in from the ALS model. Usually, by the way, if they ask you to hand you an Epi box, that's the brown box usually, and it says epinephrine on it, 1 to 10,000. 1 to 10,000 is what we give IV. It's 1 milligram has 10 milliliters of fluid. For what we give in the auto injector, guys, is actually 1 to 1,000. So 1 milliliter equals 1 milligram of epinephrine. So again, usually 0.3. We give it in the lateral aspect of the thigh, on the outside of the thigh in the big muscles. When you get it, you pull off the safety cap, you jam it onto their legs. That will activate it. It will shoot a needle into the patient's body. Hold it there for, some books say 10 seconds. I say hold it for 15. Okay? Make sure that it stays in there. Okay? Gets all the medicine in there. Okay? When it's done, you pull the needle out, throw it in the sharps box. Okay? All right. So your pediatric dose, usually it should clearly state that it's for pediatric use. And the dosage on those are usually 0.15 milligrams. So it's about half the dose. But make sure that it's, if you're using it on a kid, it is prescribed to them, okay? And again, the subsequent doses, again, we usually don't give this for the kids. Now, final note. You assist giving an EpiPen, you must contact medical control unless you're clearly, and there are some places where they allow it to administer without the doctor's order. In other words, you're allowed to get it under a standing order. Very rarely for an EMT are you going to get that. So again, make sure that you call med control. All right, and then again, we're going to give it via auto injector, via the intramuscular route. Okay, that's what the auto injector is for. Again, shove it into the leg, hold it there 15 seconds. All right, again, we can give it to our pregnant patients, the category C. By the way, category A means we can give it very safely. Category B, there's a little bit of side effects. C, we don't really have it well established. It may cross the fetal boundary. D is probably you shouldn't give it unless there's a really good circumstance. And X, you don't give it at all. So again, your category C, again, not well established on this. But again, if they're in an anaphylactic reaction, you give this to them, okay? All right, that's going to end it for this one, and I will see you guys on the next video.